Hello, everyone, and welcome. Today, we're going to tackle a topic that you see absolutely everywhere, but we need to understand it from a completely medical point of view. And that topic is alcohol. We'll be going through the key pharmacological aspects from Chapter 28 of your books.
So, here's our plan for today. We'll start with something very practical. What happens when you mix alcohol with other drugs? Then we'll answer that common question, Doctor, how much is safe to drink? After that, things get a bit more serious. We'll discuss toxicity, both short-term and long-term. Then we'll meet alcohol's evil twin, methanol. And finally, the most important part, how we can actually reverse the poisoning and save a life. So, let's get started.
All right, first things first, this is a super important point, and I want you to remember this for your entire career. You will be advising your patients on this constantly. Why mixing alcohol with other medications is such a dangerous idea.
Okay, look at this list. The main thing to remember is that alcohol is a CNS depressant. It slows your brain down. So what happens when you combine it with other drugs that also slow your brain down, like sleeping pills, anxiety medications, or strong painkillers like opioids? Well, the effect is not just 1 + 1 = 2. No, it's more like 1 + 1 = 5. It's a synergistic effect, leading to severe drowsiness and a much higher risk of accidents. And it's not just the brain. With insulin, it can cause a dangerous drop in blood sugar. And with common painkillers like aspirin and other NSAIDs, it massively increases the risk of stomach bleeding.
Now this is fascinating. Think about the liver's enzymes like workers in a factory. If you have a drink once in a while, that's acute intake. The alcohol basically tells these workers to take a break. It inhibits the enzymes. But if someone drinks heavily every single day, that's chronic use, the liver panics. It thinks, oh my God, there's so much work to do, and it hires more workers. It induces the enzymes, particularly one called CYP2E1. Now here's the problem. Paracetamol, a normally safe drug, gets turned into a highly toxic substance by this bigger, overenthusiastic workforce of enzymes. That's why for a chronic alcoholic, a simple paracetamol can become a liver poison.
This is a question you will get asked all the time in your practice. Dr. Saheb, how much is okay to drink? It's not a simple question, but there are official guidelines based on scientific evidence. So let's see what they actually say. On average, the number you'll hear is 1 to 2. For most people, consuming 1 to 2 standard drinks per day is where the health risks are considered minimal. But, and this is a very big but, it's not a universal rule. There is much more to the story. You see, it's not just about the daily average, it's also about how much you drink at one time. For men, the advice is not to have more than 3 drinks on any single occasion. For women, these limits are lower. And please understand this. This is not a social custom, it's pure biology. Women have a different metabolism for alcohol and a higher bioavailability, which means more of it enters their bloodstream for the same amount consumed.
Now this is probably the most crucial part of this section. What do we mean by 1 drink? A patient might say, oh, I only had 1 drink, but their glass was huge. It's not about the size of the glass, it's about the pure alcohol content. A standard drink has about 16 grams of alcohol. So a small 50 milliliters of spirits, a 150 milliliter glass of wine, or a 400 milliliter glass of beer, they are all roughly equal to 1 standard drink. This is something you must make your patients understand very clearly.
Okay, now we're moving from social drinking into clear-cut toxicity. Make no mistake about it, alcohol is a poison, and the damage it does depends a lot on the pattern. Is it one massive dose or a slow, steady poisoning over years?
Let's just compare the two. Acute poisoning is an emergency room situation. The patient is unresponsive, their blood pressure is crashing, and their breathing is dangerously slow. This can quickly lead to coma and death. Chronic alcoholism, on the other hand, is like a slow demolition of the entire body. It leads to irreversible scarring of the liver, cirrhosis, plus pancreatitis, high blood pressure, nerve damage, and various cancers.
For some people, there is simply no safe limit. For the groups you see here, alcohol is absolutely contraindicated. For someone with a peptic ulcer, it just makes things worse. For an epileptic, it can trigger seizures. And of course, for anyone with a badly damaged liver, drinking alcohol is like pouring fuel on a fire.
And this brings us to one of the most tragic outcomes. Just read this quote. Fetal alcohol syndrome. The damage is devastating and it is permanent. A child born with low intelligence, a small head, and specific facial problems, all because of alcohol exposure in the womb. Let me be perfectly clear. There is no known safe amount of alcohol during pregnancy. Period. Not 1 drop.
Okay, let's now shift gears and talk about ethanol's deadly cousin, methyl alcohol, or methanol. This is not a drink. This is an industrial solvent. And methanol poisoning is a true toxicological emergency, one we often see from people drinking cheap, illicitly made liquor that gets contaminated.
The amount needed to cause harm is terrifyingly small. Just 15 milliliters, 1 tablespoon. That's enough to cause permanent blindness. The fatal dose is maybe 75 to 100 milliliters. This is why you hear those tragic news stories about dozens of people dying after drinking contaminated liquor. It's almost always methanol. So why is it so incredibly toxic? The key is right here in this metabolic pathway. Both the alcohol we drink, ethanol, and this poison, methanol, are processed by the exact same enzymes in the liver, alcohol dehydrogenase and aldehyde dehydrogenase. They go through the same factory line. But the final product that comes out in methanol's case is the real villain.
You see, the danger is not methanol itself, but what the liver turns it into, formic acid. This explains the characteristic delay in symptoms. It takes a few hours for this poison to be produced. As the formic acid builds up, it makes the blood severely acidic, and it specifically attacks the retina in the eye. That's why patients complain of blurred vision, like seeing a snowstorm. And remember this key clinical sign. In fatal cases, blindness always happens before death.
So, a patient with suspected methanol poisoning arrives in your emergency department. What do you do? This is a race against the clock. It's a race against the production of formic acid in the liver. Every minute counts.
The treatment follows a very logical 4-step plan. First, you have to fight the acid, so you give intravenous sodium bicarbonate to neutralize the formic acid in the blood. Second, you have to shut down the poison factory in the liver, stop it from making more. Third, you need to clean the blood, so you use hemodialysis to physically remove the methanol and formate. And finally, you can give folinic acid to help the body break down the formic acid that has already been made.
Now let's go back to that diagram and focus on step 2. How do we block the metabolism? Amazingly, we use ethanol, yes, regular drinking alcohol, as the antidote. Why? Well, because the enzyme alcohol dehydrogenase has a much higher affinity for ethanol. It prefers ethanol. So if you flood the body with ethanol, the enzyme gets busy working on that and completely ignores the methanol. The methanol is competitively blocked from being converted into its toxic form. It's a brilliant strategy.
But, as you can imagine, giving a critically ill patient alcohol as a treatment can be tricky. You have to manage their intoxication. So, these days, we have a much better, smarter option, a drug called fomepizole. It is a specific inhibitor of alcohol dehydrogenase. It goes straight to the enzyme and shuts it down, without causing any intoxication itself. It is much safer, much more effective, and it is the modern drug of choice.
So, as we wrap up, I want to leave you with this question to think about. We've seen just how fine the line is between something social and something deadly. This knowledge isn't just to help you pass an exam. It fundamentally changes how you view a simple drink, and it equips you with the principles you might need to save a life one day. Thank you.